Good afternoon, everyone. My name is Dr. Crystal Broussard, and I'm a local gastroenterologist at Bergen Medical Associates right here in Emerson, New Jersey. And I'm happy to have you here with me today to share about some important things about colon and rectal cancer. Ironically, this month, March, is National Colorectal Cancer Awareness Month, so I'm very happy to be sharing with you and sharing my knowledge about the importance of colon cancer screening. So I want to give you a couple of facts about colon cancer just to start things off. First of all, colon cancer is the number 2 cause of all cancer death, and it's preventable and it's curable if caught early. It is also the number 3 cause of all cancer, so it's a very prevalent condition. In fact, annually there are about 140,000 people who are diagnosed with colon cancer, and about 50,000 of those patients pass away. So it's a very important health concern in our community, and I want to share the facts about it with you so you can make an educated decision about screening for colorectal cancer.
So what causes colon cancer?
Colon cancer is a condition that is caused by typically by small abnormal growths in the colon called polyps. Polyps are how the majority of colon cancers can develop. And not all polyps, thankfully, are going to become cancer, but there's a certain component of polyps that do. And these polyps are called adenomatous polyps. And adenomatous polyps make up about 70% of all polyps that we see on colonoscopy exam. So the benefit of screening is that we can get to these polyps before they become cancer and before they cause a problem in your life. So that's why screening is so important. Unfortunately, or I should say fortunately, the bulk of polyps that we see on colonoscopy do not cause cancer. And even in adenomatous polyps, only about 5% go on to become colon cancer. But the important thing is removing these polyps before they can potentially become a problem.
What are some of the symptoms that can be associated with colon cancer?
Some of the symptoms associated with colon cancer include, well, the most concerning is that actually, this is why we screen, sometimes you don't have any symptoms, and that's why screening is so important. By the time you have symptoms, it's possible that your colon cancer is more advanced. But those symptoms can include rectal bleeding, change in bowel habits, abdominal pain, unintentional weight loss, and for some people, just finding abnormalities on their labs. Unexplained iron deficiency anemia sometimes can be a hint that there's something going on within the gastrointestinal tract. But this is why screening is so important, because you want to catch these problems before you have symptoms. So that's why sometimes even people who come in for their first time exam may have a colon cancer. But the good news about that is that it's going to be diagnosed earlier in its stages and potentially very treatable and curable.
What are the risk factors for colon cancer?
Colon cancer has several risk factors. Some are environmental and some are genetic or predisposed because of your family risk. As far as environmental factors, those might include being overweight, obesity, tobacco, excessive alcohol or moderate alcohol use. I think some other things that would be included in that would be making sure that your diet is healthy. High fiber is a positive. High red meat is a negative. So diet plays a big role. High red meat content, low fiber can also increase your risk of colon cancer. Family history also plays a role too. So if you have a first-degree relative with colon cancer, that increases your risk more than the average patient, at least twofold. So family history plays a very big role. One first-degree relative or even multiple first-degree relatives or second-degree relatives can increase your risk for colon cancer. So family history is very, very important. So make sure you ask your family about their health history.
Are there certain ethnicities or races prone to the disease?
Unfortunately, there are some ethnicities and racial makeups that can increase your risk for colon cancer. Over the past 10 years, it used to be thought that, or it is true that there were a lower incidence of colon cancer. However, we found that over the past 10 years, there's actually a higher incidence of people younger than the age of 50 being diagnosed with colon cancer. That's been a dramatic change over the past 10 years, a higher incidence of people younger than the age of 50 being diagnosed. So that's become a big concern, and that's almost why we now consider recommended screening at the age of 45 as opposed to the age 50.
What are the screening tests for colon cancer?
There are multiple screening tests for colon cancer. The most efficient and protective test is the colonoscopy itself, because with the colonoscopy, you can not only diagnose, you can potentially treat by removing polyps and confirm cancer if it's there. Other screening modalities would include a stool test. One is called a fecal immunochemical test, which is a test that looks for microscopic blood in the stool. There's a stool DNA test called a targeted, multi-targeted DNA test, which looks for genetic abnormalities in someone's stool that may increase their risk for colon cancer, as well as looking for microscopic blood. There are imaging studies, including a CT colonography, which is a fancy imaging technique to screen for colon cancer. There's even something called a colon capsule, where you swallow a video capsule, which takes a picture of your entire large bowel to screen for polyps. And there's also something called a flexible sigmoidoscopy exam, which is a very limited look inside the colon, primarily just the left side of the colon. And then there's also a blood test. But all these other tests, besides, I think I forgot one, the virtual colonoscopy, that's actually a fancy imaging test that looks for colon cancer or colon polyps. But all the other tests besides the colonoscopy are what we call two-step approaches. These other modalities outside the colonoscopy can only find an abnormality, but it cannot potentially treat or confirm a cancer diagnosis. So colonoscopy is really the most efficient and effective way to diagnose and screen for colon cancer. But the good news about all of that is people do have options. So if you're not particularly interested in having a colonoscopy, you have these other modalities I talked about, which are effective in screening. But ultimately, if those other modalities are abnormal, you're going to probably wind up having a colonoscopy anyway.
At what age should you get your first colonoscopy?
I kind of alluded to that earlier. Screening used to be recommended, or it's still recommended 50 or above in age. However, over the past 10 years, like I said, we've seen a higher incidence of people younger than the age of 50, particularly between 40 and 49, developing colon cancer. So for that reason, multiple societies have recommended to begin screening starting at age 45 now, even for the average risk person. That's someone who has no family history. Three major societies, the American Cancer Society, the American College of Gastroenterology, and another society have all recommended screening to begin at the age of 45 now.
What is involved in a colonoscopy examination?
A colonoscopy, which is considered the gold standard of screening, is not a big deal. Basically, this test is done in either a surgical center or a hospital-based procedure room. Basically, the test involves being given medicine through your veins by either an anesthesiologist or a doctor who's doing your procedure, and then a flexible camera that looks similar to like a flexible scope with a light and a camera at the end of it gets inserted into your rectum to look at your entire large bowel. You are asleep with this, you are comfortable, you are relaxed, there's no pain involved, so you are not even aware that this test is being done. And that's the benefit, because this test can be done safely and comfortably, so there shouldn't be any fear about pain or discomfort. But once you are asleep, this camera gets inserted into your rectum to look at your entire large bowel. And that can take on average between 10 to 20 minutes, depending upon what's going on and how difficult or easy the procedure is. But what we're looking for are these abnormal growths called polyps. So if we see a polyp during the time of your procedure, it gets removed immediately and it gets sent to a lab to be analyzed. And that turnaround time can take a week or 10 days. But basically, when your procedure is done, your doctor can tell you pretty much if you have any polyps and if there's any concern about the polyp's appearance. Ultimately, the pathology confirms when you should come back for another exam. But if you don't have a colon polyp, then you're good for at least 10 years before you need another colonoscopy. So that's the good news too. The hardest part of the preparation for the colonoscopy is preparing for it, because you have to clean out your colon. And that's what I think a lot of people are kind of concerned about and don't want to do. It is a necessary part of the process. You get cleaned out the day before with a solution that your doctor will either prescribe you to drink, or even you can use something over the counter that you're directed to take to help really eliminate all the contents of your colon. So you'll be having a lot of liquid stools, but that's very important, because if you're not cleaned out, it affects the quality of your exam. And affecting the quality of your exam allows us to potentially miss problems, including polyps or cancer. So the cleaning out process is very important to the whole procedure. But the good news is that over the past several years, There have been easier preparations or solutions to clean out, so it's not so labor intensive for the patient and not so difficult. So none of this should preclude someone from getting their screening exam.
How can you reduce your risk of colon cancer?
There have been studies to show that diets that are high in fiber, diets that are low in red meat or processed meat, moderate exercise, not being obese, not drinking or smoking, all those things help to reduce your risk of colon cancer. So staying healthy, exercising regularly, watching your diet, and obviously paying frequent visits to your doctor to make sure that everything is okay is also very important. But screening saves lives.
Is rectal bleeding a sign of colon cancer?
Rectal bleeding can be a sign of colon cancer. Rectal bleeding can also be related to internal hemorrhoids, which are dilated veins in the rectum. Rectal bleeding is a warning sign. It does not have to be colon cancer. It could be a hemorrhoid. It could be inflammation within the colon. But whenever you have rectal bleeding, especially if it persists, it definitely warrants seeing your doctor or seeing a gastroenterologist for further evaluation. You don't want to presume it's a hemorrhoid. You want to know it's a hemorrhoid. And the one way to find out is by getting an evaluation by a doctor and a colonoscopy.
What is the complication rate for screening colonoscopy?
The complication rate is actually quite low. The complications associated with colonoscopies include bleeding, infection. The most serious complication is poking a hole in the colon. That's called a perforation. The bulk of these complications are less than 0.01%, so the benefits far surpass the risk. Far surpass the risk. There's also some complication with having an adverse medication reaction, but all these risks pale in comparison to the benefits. The risks are real, but they're not common, and the benefits far surpass the risk. This test saves lives more than causes injury.
Can you survive without your colon?
Yes, you can survive without your colon. In fact, one thing I didn't talk about as a risk factor for colonoscopy is people who have inflammatory bowel disease, such as ulcerative colitis or Crohn's disease. So people who have this inflammatory condition of the colon, particularly ulcerative colitis, sometimes these patients may have to have their colon removed due to severe illness and also because of the risk of colon cancer, because people with ulcerative colitis who have extensive bowel disease, once they've had their disease for at least 8 to 10 years, their risk for colon cancer goes up. So sometimes because of health history or medical problems, they need to have their colon removed. And so they are able to survive and they do well. You have to have what's called an ostomy. So your digestive juices come out of or your fecal contents come out of your abdomen through a pouch, but you can survive without your colon.
Are there circumstances where a screening colonoscopy is done before 45?
Absolutely. If you have a first-degree relative who, say, got colon cancer under the age of 50, if you had a first-degree relative who had a colon cancer, say, at age 45, we would recommend screening at least 10 years earlier than that relative was diagnosed. So absolutely. If you have a first-degree relative under the age of 60 and they have colon cancer, we recommend screening either at age 40 or 10 years earlier than when they were diagnosed. So the earlier that this family member is diagnosed, who's a first-degree relative, at least 10 years earlier than that, we recommend screening. So absolutely. Well, it's been a pleasure talking with you today. I hope I answered some of your questions, and I hope I put you at ease regarding considering screening for colonoscopy. Remember, this is the #2 cause of all cancer death. It's preventable, it's curable when it's caught early, and screening colonoscopy saves lives. I'd like to thank the hospital for allowing me to talk today, and you guys have a wonderful day. And if you want my information, that will be shared on the website. Again, Dr. Crystal Broussard, thank you.